for a medical student who's interested in surgery residency, it's beyond, I think, just showing up. It's demonstrating interest in staying for cases, going to cases, really trying to understand why our patients are having their operations done. Some like important things to know about what's the relevant anatomy for that operation. What are some common complications to know about for the case that you're watching? And then what I'm mostly very impressed on for the medical students that rotate with us is, do they take these patients under their wing, and do they really take ownership of their patients? And if you show up every day to present on morning rounds and you've thought about a plan, or you've chatted with your junior resident about the plan that you intend to propose to your chief resident, that shows layers of care about the process and about your patient. I think that that's really important.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello there. I'm so excited because we have a very special guest today, Dr. Joshua Roshal. I'm just going to give him an opportunity to introduce yourself and tell us a little bit about your journey to medicine.
Awesome. Thanks so much for having me on the show, Dr. DeRouen. I'm Josh. I'm currently a general surgery resident, but I grew up in New York, about five hours away from where I'm from now. In terms of my journey to medicine, I didn't really want to do medicine in the first place. My parents were in medicine. They came over to this country and redid their training. So to me, it seemed like a very long road of education. But then, my mom was dealing with post-operative things after she had breast cancer, and she had surgery to have her breasts removed, and I was involved in her post-operative care. And from that was like my first real direct experience in medicine, where I was like, oh wow, like I can have a tangible impact on somebody's life just with doing like either learning something or using my hands. So then I went to undergrad. I studied neuroscience because my brother was in medicine. He's a neurologist, and he's like, oh, you should check out neurosurgery. And from that point on, within undergrad, I applied for a 7-year BA/MD program. I got in with my good friends. I was very lucky to have an excellent support system going into medical school. Also did a lot of experiences within undergrad, whether it be teaching or leadership experiences involved in student government, that I ultimately think helped me become a more well-rounded medical school applicant. And then once I was in medical school, I still found that I loved surgery. But the thing that drew me to general surgery is that we're kind of like internal medicine doctors that can also operate. We really are, a big part of our training is learning how to take care of the entire patient after they have their operation. And then throughout medical school, going from college, that's when I started teaching. And now that's kind of what my major research focuses are, is how do we improve education, especially now in the pandemic age of, everybody's not trying to be in person anymore. In my medical school, everything was recorded. So, you learned everything you needed to do online. You had resources like Sketchy Medical, Boards and Beyond. So that's kind of who I am and what my interests are now.
I love that. And I love how you kind of took us through your journey of your personal experience with being introduced to medicine through situations that we typically don't want to be introduced to medicine with. But it's what drives a lot of us to the field, because we want to help people and we want to make people's lives better and do research and those things that can help people live better lives. So from there, you went to a 7-year medical program, which is awesome. I did something similar for my medical school program too. So for those who are listening out there, there are some programs where you can do combined undergraduate and graduate, or they can be like 7-year programs, 8-year programs, and things like that, sometimes 6. So those are something you can definitely look into, because sometimes you take courses in the medical school while you're in the undergraduate school, and you can get some credit for it, or at least learn what to expect. So it won't be so overwhelming when you do matriculate into medical school.
True.
And then, as you mentioned, medical education is changing, which is a good thing. So we're in a digital age, and they're calling this generation the Zoomers, whether or not we're or not. So we're Zoomers, here are the Zoomers. So we have to restructure the way that we learn. you are involved in surgical simulation and multimedia teaching of anatomy. And we all know that anatomy is important not only for all of medicine, but especially surgery. Like, we don't want you like messing with the wrong bones and stuff. So
It's true.
why do you think that, aside from like the pandemic and things like that, that kind of pushed the demand into medical education, why do you think it's here to stay?
Well, yeah, I mean, it's a catalyzing question right now. And I think that the pandemic definitely forced everyone across all educational spheres to reevaluate what does it mean to teach someone, and do you need to be in person? And I think that in medical school, things have really caught up. You know, there's plenty of data out there that shows that medical students sometimes don't even pay attention to their own school's curriculum, and they do a completely their own curriculum on their own time.
Mm-hmm.
Like, I mean, I used cartoons to learn pharmacology, and I think a lot of current residents in medicine have. So when you get to a very time-consuming specialty like surgery, things just haven't gotten up to that point yet. When you start surgery residency, you're told, choose one of these 3 major textbooks. They're about 2,000 pages long, and find time to read it. And you have to find time between your clinical responsibilities, being in the operating room, taking care of patients, to study for your board exams with the idea of eventually passing your boards. And programs, you know, have some sort of structured education that's in person, but, you know, surgical residents are on call, and or they might be post call. They don't want to go to in-person classes. And the data kind of shows that the attendance rate for a lot of these courses that are in person are very, very low. People either don't find them helpful or they don't want to go to them. And then on the flip side, there are some courses out there that try to give you a review of the things that you need to know in order to pass your boards. But they're wildly expensive, and they're often not available to people who are, you know, outside of the country. And so that's kind of where my perspective comes in, is how do we make it easier and democratize the access to surgical education? Whether it be learning how to do procedures, when in and of itself, there's a lot of variation depending on the provider that's doing them or the institution, to even just more knowledge base of what does a surgery resident need to know, and how do they learn that information in the most effective and efficient way in order to be successful at the bedside, in the operating room, and on standardized exams. And there's movements towards that. There's the Surgical Council on Resident Education, or the SCORE curriculum, that really, you know, only recently in the past 20 or 30 years that defined what does a general surgery resident really need to know. And it might be different depending on if you're practicing in Boston or in rural Texas. But now working on delivery methods of how do we kind of teach that information is something that I'm interested in.
I love that. And I think that you brought up a lot of key points. Like, medical education is evolving. I know when I was in medical school, and I won't date myself, it was in the past 5 years. The biggest thing that we had was going to lecture, YouTube, and some of the Q banks that were becoming popular. And everyone, like you mentioned, may have a different learning style, or they want to be more efficient. So I know for those who are currently in medical school, you may do like I did. And I took the syllabus, I went somewhere else, not the library because it wasn't as fun, but like some of random places to study, and made my own PowerPoints and things like that, and utilized a lot of the things that were not provided by the instructors or by the books, and did Q banks and things like that, whereas other people may have found benefit in going to the lectures. So there's something for everyone. But you brought another layer to that when you talk about you being a surgical resident. So not only do you have the responsibility of the M1 and M2 years of medical school, or when you get some clinical responsibility for 4 to 8 weeks, but now this is your life. You have to figure out how to integrate doing well clinically, knowing your patients well because they belong to you, you're prescribing, all of those kinds of things, and having that time to sit down and also study and retain the information and know it so that you can pass your boards while living your life. So that's
right. You're juggling all these things. But yet the way we do them is still kind of what people used to do in the past. So
yeah. So we definitely have to innovate with medical education. I'm curious for you, like I'm a family doctor, so I'm not as procedure heavy as like a general surgeon. So how do you work with surgical stimulation for education from home?
That's great. And I think that that's a field that's really being explored right now,
Mm-hmm.
especially when we look at the industry and you start to take a look at what options there are for things like virtual reality. And right now, there are what a surgical resident can do, for example, in practicing operative skills at home. It's a little bit limited. There are some applications out there that kind of take you through the step by step of how to do a procedure, but it's really just like clicking a button and walking through it. The other thing that, some of us have access to, depending on the programs that we go to, what resources we have, are laparoscopic box simulator training. But it's essentially, you have essentially a cardboard box and you have the laparoscopic instruments, but you're doing things you wouldn't really do in the operating room. It's like move a peg from one place to another, maybe tie a suture around. And that's good and all in terms of practicing for, we have an exam to test our fundamentals of laparoscopic skills, the FLS exam. But when it comes to practicing in the operating room, there's a question of, does that really apply? Does your ability to, tie a suture using very standardized conditions on a felt pad translate to doing the same thing when you're in the OR? And there's definitely developments on the industry side of how do we make a virtual reality based surgery education platform. But at this point, it's now going from how do we go from the industry to make it widely available for surgical residents? So that's something I'll be interested in taking a look at. Right now, one of the things that I'm also interested in looking at is how do we teach anatomy to surgical residents? And there's a common saying amongst us is that anatomy is wasted on medical students, because once you move past medical school, you don't really have the opportunity to do cadaveric dissections again.
Mm-hmm.
But you're working with real people and you're doing operations on real people. So there's some programs out there that do wet labs as a part of their surgical residency, but it's very resource intensive, and it's hard to really get those opportunities out to other places in the country that don't have those opportunities. So using virtual reality is a platform for that. If you can learn how to do a laparoscopic cholecystectomy by watching it in your screen at home, maybe that'll lead to improved operative autonomy when you're actually doing it for the first time.
That'll be very interesting to see because, like you mentioned, like aside from pathologists, I don't really see anybody working on bodies after
Right.
medical school. So it will be very interesting to see as things evolve with virtual reality, AI, how things will transform over time.
Mm-hmm.
So I've mentioned that we have a lot of pre-meds and med students listening here, and a lot of them may be interested into matching into a surgical subspecialty. So what tips do you have for students who may be interested in matching into surgery, like in terms of like how to thrive? Like we know, show up on time, like those kinds of things. But what are some tips that you would have for someone who's seriously considering surgery?
For sure. And I think that surgery compared to some of the other specialties does require you to be in the hospital, where, for some of the less procedural specialties, you can learn a lot of the things you need to know using books and other resources. But at the end of the day, to learn how to do an operation, for now, you kind of have to be there. And that's why surgical residency tends to be so time intensive. So for a medical student who's interested in surgery residency, it's beyond, I think, just showing up. It's demonstrating interest and staying for cases, going to cases, really trying to understand why our patients are having their operations done. Some like important things to know about what's the relevant anatomy for that operation. What are some common complications to know about for the case that you're watching? And then what I'm mostly very impressed on for the medical students that rotate with us is, do they take these patients under their wing, and do they really take ownership of their patients? And if you show up every day to present on morning rounds and you've thought about a plan, or you've chatted with your junior resident about the plan that you intend to propose to your chief resident, that shows layers of care about the process and about your patient. I think that that's really important. That's kind of step number one. The next step is surgery tends to be a very small field. So trying to find people that you think would be good mentors to you, whether it be a resident or the attendings that you work with, and setting up a meeting. I know that it's can be really intimidating. Surgeons can have very fiery personalities. So it could be tough to come up to them sometimes and say, hey, I'm interested in surgery. But that's why they're there. If you're at an academic institution, they have some interest in teaching. If you say, I want to set up a meeting and talk about what it means to be a surgeon and what do I look for and how do I apply to a program, those are the people that are going to be really vouching for you and mentoring you through the match process. So really, it's just showing up. That's a huge part. Demonstrating interest and that you care for your patients and really taking ownership of them. And then going the extra mile in terms of when you're on your clinical rotations. One of the things we look for is, does the student have situational awareness? That becomes a major aspect of the operating room. And it's a form of nonverbal communication in the sense of, if there's something crucial going on in the operating room, like there's a lot of bleeding or an important step happening, might not be the best time to ask a question. And it's these small things that ultimately influence how people perceive your situational awareness. And, if you do that, you care about your patients, you practice outside of the operating room how to suture and some of your technical skills, but nobody really expects you to do, to be able to be a surgeon as a medical student, just like the interest in doing so. And then, reaching out to mentors and trying to find guidance, because it's really tough to do it alone. So, whether it's your own colleagues or faculty advisors, they'll be able to help you.
I think that that's excellent advice. Like, especially just being aware of your surroundings and having that emotional intelligence to connect with your patients, to try to look and investigate like what it actually does mean to like be a surgeon, because it can be fun for 6 to 8 weeks, but is this something that you want to do for a career for 30 years? And getting that inside scoop and finding those mentors is very important, especially finding mentors when it's time to get your letters written or people when you're going through the interviewing process and things like that. So I think that that's tremendous recommendations. Mm-hmm. Now, my question for you that I love to ask all my guests as we almost come to a close is, we all know that the U.S. healthcare system is not perfect. Oh my God. If you had a magic wand and you could change anything about healthcare, what's the one thing you would choose?
Oh man, this comes from someone who's rotating on a vascular surgery service right now, where it's a lot of chronic disease. And unfortunately, we catch people when they're already in a significant progression of their disease state. And in my own personal experience, I would say we need to shift to a model of preventative care and working with primary care physicians, family medicine physicians, and really trying to catch diseases before they start to cause problems. It's not even just for financially, because, the U.S. healthcare system causes major amounts of stress on our society as a whole, but just the proper thing to do for someone's health. And, seeing that on the front lines it's very hard to meet with a primary care physician, even as a resident, somebody who's has a certain amount of health literacy and is in the field. It takes me 6 months to find a primary care doc. So I can only imagine somebody who, isn't as fortunate, it's not as privileged to have to navigate this system and find people who would advocate for them and their health. It sounds incredibly hard. So I think that we really need to focus on more preventative medicine rather than, a lot of the interventions and things that unfortunately hospitals find themselves in right now, either as a result of the pandemic, with a lot of backlogging and, people starting to progress in age, leading to the development of some of these chronic conditions. We really need to focus on outpatient preventative medicine.
I love that. You are speaking my language. Someone who's a primary care doctor, like, prevention is key. And for the listeners out there, I know that they kind of give doctors a bad rep, especially surgeons, because they're like, money, money, money. Like, they just want to operate. No, we all care about you and we want you to thrive and we want you to live well. Like, that's why we're here. So if you haven't seen your primary care doctor this year, even if you're feeling well, go see them.
Just do it.
Yes, just do
see your primary care doc.
Just do it. And if you're a lady, I know the ladies between 20s to 50s are like, I see my GYN. There's more to your body than that area. So
Great point.
yes.
No, definitely see your primary care doc. Oh my gosh, I can't stress that enough. It's so good to like just check in and have someone else just give you their point of view. You might think, I noticed my heart rate is a little fast. You might not think about that, but or your blood pressure is a little high. But those are the things that can be stopped early on and that we could take care of before they start to cause issues later on in the future. So 100% primary care.
Absolutely. So it was such a pleasure to have you on the show today, Josh. I just want to give you an opportunity to say goodbye to all the listeners and tell them how to reach out to you if they had any questions.
Yeah, for sure. Thanks so much for having me on the show, Dr. DeRouen. If anyone's interested in surgical residency or surgical education, feel free to reach out to me on Twitter. I'm at Joshua_Roshal, Roshal. I'm happy to kind of mentor you if you're applying for the residency process. I know right now we're about finishing up interviews. We're getting to the ranking process. If you have questions, please feel free to reach out.
Thank you so much. And for all of the listeners out there, click that subscribe button. Feel free to reach out to us on our social media at Med School Coach or at Dr. DOCTOR, the letter D, GRAM, Dr. D Graham on Instagram, so you can request any show topics or specific guests that you want to see. See you guys next week. Bye.
Bye-bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.